Hi there, Dr. Jess here, and today we are going to be talking about a very long word that's called Phlebolymphedema. So essentially what all that means is a very long word that means that you've got swollen legs and feet. Just kind of a fancy way to say it. Now, let's talk about this diagnosis of Phlebolymphedema and essentially get a little bit of a better understanding of not only anatomy of the vascular system, which is going to be arteries and veins, and then the lymphatic system as well. So it's two separate systems that all help with circulation of fluid throughout our body. Then we're going to talk about what can go wrong with the vascular system, and then essentially then what can go wrong additionally with the lymphatic system, and then what we can do about it. Okay. Now, first off, I always like to go through what's normal. What's our normal anatomy so that we have a good understanding of that before we talk about what goes wrong. Now, the vascular system, essentially we can think of it as 5 different types of vessels that comprise the vascular system, and they all have a common pump to circulate that fluid. It's a closed system, and the pump is your heart, all right? So you've got arteries, which have oxygenated blood, and they're going to pump fluid to the tissues in your bodies that need oxygen, because oxygen is what helps a muscle to contract, for example. Then that artery turns into an arteriole, and then it turns into a little capillary, and this is where the oxygen is able to diffuse into the area where it needs to diffuse. And then the now deoxygenated blood, it comes back to the heart via venules and then veins. So it's just constant circulation of blood, which has cells in it, to get our tissues the cells that they need. So that's the vascular system. Now let's talk about the lymphatic system. So this is normal. This is all normal anatomy. So the lymphatic system is a little bit different, okay? So instead of this common pump that's constantly circulating fluid throughout our bodies, the lymphatic system has the vessels themselves have their own little pumps. There's a muscular wall, and then we've got this pump that happens, okay? And so we call it an angiomotoricity, or the rate at which that vessel is contracting, boom, 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 boom. And that's what kind of helps to push the fluid through the vessel. Now, the lymphatic system is very picky about the type of fluid that it's going to pick up. So the lymphatic system is a system in our body that's going to pick up any sort of cellular debris that might be in there. There could be inflammatory cells. There could be let's say you've got like a little virus and you're trying to fight that, or like a little bacterial infection, anything like that, any of these extra cells that might be kind of floating around in our body, they're going to get picked up in your lymphatic system, which is why it's really important that this fluid is then cleaned. The venous system, on the other hand, okay, that's really only going to pick up, it's very picky about what it picks up. Pretty much carbon dioxide, which is a byproduct of a muscle contraction. So that fluid doesn't have to get cleaned to go back into the heart to then be reoxygenated through the lungs and then pumped back out again. But lymphatics need to be cleaned. So now that adds in lymph nodes. Okay. So when we think of like, we hear about lymph nodes and they get swollen when we're sick. It's like, oh man, like my lymph nodes on my neck are much larger than normal and sore. It's like, oh, okay. So those lymph nodes are helping to clean out the yuck that your body's trying to fight. So that's a really good example of the role of the lymph nodes. So that's kind of how our lymphatic system works, is that it's going to pick up all the cells that the venous system doesn't, but then it needs to clean that fluid. So then that fluid then turns back into the heart, and then it gets recirculated and pumped again. And then anything that's extra that you don't need, you just pee it out. So that's overall circulation. Now let's talk about what can go wrong. So we're not here to talk about everything that goes right. We're here to talk about what goes wrong. So chronic venous insufficiency is something that's quite common, and this happens to the veins. So this is more of that first system that we talked about. So our veins are very particular because they don't have a muscular wall. So the arteries, they're like pump, pump. Oops, let me go here. Pump, 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 and they're pumping that blood through the tissue. The veins don't have that same muscular wall. So veins have a series of these back valves, okay? So because of the pressure that's put onto the veins via our muscles contracting or gravity, things like that, it's helping to push the fluid back up the leg, okay? Now, over time, what can happen is that those venous walls can start to give way a little bit. They're not as strong as they used to be. Those valves might start to give way a little bit. So now, instead of the fluid only being able to go up but not down, okay, because we don't want fluid going down, we want the fluid eventually going back to the heart, that little valve can start to give way. And when it does, it allows fluid to go back down the leg. So this failure of the valves leads to a couple of different changes. So, but we'll talk about those in just a minute. But symptoms that typically you might be feeling, you might see varicosities, you might see some skin changes, but you also could be having an increase in leg cramping. You could have an itchiness in your skin. You could have an increase in restless leg syndrome. You could have some pain and heaviness. These are all symptoms that you might feel. Now, there might be also something else that's causing these symptoms. Is not only chronic venous insufficiency that causes, for example, itchy skin. You could have poison ivy. Okay, so there's other things, but just, when you're correlating them all together, then it's like, let me see what's going on. So what's causing this? What causes chronic venous insufficiency? So if you're somebody that does prolonged standing, so cashiers, people that are on their feet all day long, they have that increased risk of chronic venous insufficiency. As you age, just the life of that vessel is much longer, and things can start to go wrong. Anybody that's had reduced mobility or activity. So say, and that could even be just working a sedentary job for long periods of time. You could be, you were active before, and then you had an injury, and now you've been a little bit more bedbound or more chairbound. You could have a history of blood clots. That's going to put a pretty big strain on the vein. History of tumor, that's just a mechanical compressor that could be going on. And then you could just have some sort of a congenital malformation. I mean, that happens too, where it's like you did nothing to cause this. That's your luck. Some of us have that and some don't. All right, so what are we looking for with chronic venous insufficiency? So I was kind of talking about that we have these skin changes. So it's called hemosiderin staining. So, and I know you've looked around and you've seen this before, okay? These are the individuals that have that dark area of skin around the, essentially it's typically the front of the shin first, and then it starts to really wrap all the way around, okay? You could have swelling, so one leg is bigger than the other, both are bigger. The ankles start to really fill out, the feet really start to fill out, okay? The varicose veins, or that bulging of those veins that you can see. And then you can also start to get wounds, okay? So this is not good, and really want to catch it before we get those wounds. The wounds are quite common, especially when it's on the lower part of the calf. That's a really common spot, just because if something happens, you get a little cut, or like a little pressure spot builds up, that you're not going to heal very well from that. And the other thing that's common are infections. So you could get cellulitis as a skin infection, and that's very serious, and that can very much put you in the hospital. So we don't want this. We want to stay ahead of this and use education to drive early intervention. Okay, so now let's go into Phlebolymphedema. So it's like, I've heard of lymphedema, but I've never heard of Phlebolymphedema. All that means is that there's two components to why you have swelling. Typically, most often, this is in the legs. Commonly affects the calf, the ankle, and the foot is really where it's most common. It's going to kind of start further down the leg and then work its way up as far as the swelling goes. So what we see with this is that it's a mixture of swelling. It's a venous swelling, and it's a lymphatic insufficiency. So typically what happens is the chronic venous insufficiency is first, so the veins start to fail. We get this buildup of fluid in the legs. That buildup of fluid is then going to put a strain on the lymphatic system, because the lymphatic system is now going to have to pick up more fluid than it typically would, because the veins aren't doing their part. So now the lymphatic system gets stressed over time, and now we start to see this combination of swelling. So it's not just a venous swelling, but there's a protein rich swelling. That's what happens when the lymphatic system starts to break down. So so overall, it's a combination. Now, let's learn a little bit more about this population. I think there's a lot more individuals that do present with this that don't realize that they have this. I see it all the time in the clinic. We'll have a patient that's coming in because of back pain or hip pain, something like that. And I'll walk through the clinic and I see their legs and I'm like, hey, has anybody talked to you about the swelling in your legs? And they're like, oh, no, I mean, I take my water pills sometimes. I mean, their legs are big and like really high risk of wounds and no compression on whatsoever. And it's like, okay, well, if you have interest in containing that a little bit more, it's really not that hard. We can try and get that under control so we keep you as healthy as possible. And they're like, oh, I didn't know something could be done. And so I just, how much I see it, I think that we should really try and be educating a little bit more, which is why I'm doing this video. Okay, so Phlebolymphedema, it affects 5% of the US population. So when we think about the entire population of the US, that's a good amount of people actually. It is a leading cause of lymphedema. So we think of lymphedema because, especially in the breast cancer world, there's been a good amount of talk about lymphedema, and that's great. I'm glad that the word is getting out. But what we're not talking about enough in the world of swelling is phlebolymphedema and swelling into the legs, because it's very, very common. So if you have phlebolymphedema, you are 4 times higher risk of developing cellulitis than somebody that does not have swelling, okay? And like I said, cellulitis it can be a very serious skin infection that can get to the point where it hospitalizes you, and it's not good. So 49% of cellulitis is from phlebolymphedema, whereas only 14% of cellulitis is from cancer-related lymphedema. So we're seeing that this is a pretty big issue, okay? And early intervention is very important, okay? So at stage 2 of lymphedema, there's a 30, and this is just true, just basic lymphedema, there's a 32% rate of cellulitis, versus when we get into that later stage of a stage 3, there's a 62% rate of cellulitis. And so we really want to decrease that risk, because that's burden on the healthcare system, that's burden on your wallet, and that's potentially putting you at risk of not good stuff happening, okay? We don't want our patients being, or anybody in the community being hospitalized unnecessarily, okay? If it could be prevented, okay? All right, stages of lymphedema, which is we're going to kind of say that this kind of falls right into the phlebolymphedema as far as the stage 1, 2, 3, and 4 with the phlebo. The biggest thing that we're seeing different than these pictures are some of those skin changes. The hemosiderin changing, you see a little bit more varicosities typically, so that darkness on the front of the skin. But in general, this picture is a little bit cleaner to kind of show you the stage of the swelling that happens. So in stage 1, there's swelling. It's there typically when you elevate the leg or sleep overnight, that swelling goes away. And then you wake up in the morning like, oh, my ankle's not swollen. And then the day goes on, and then you're like, oh, wow, like, man, my feet and ankles are pretty much always swollen at the end of the day, but better in the morning. That's the stage 1. When we get to the stage 2, and the swelling starts to now stay all the time, you wake up in the morning and your ankles are still puffy or your feet are still puffy. And so that's that stage 2. That's not going away with elevation alone. When we get to stage 3, that's when we start to see the beginning of some fibrosis. The swelling is there all the time. And fibrosis just means that swelling has now kind of changed a little bit. It's not so fluid, it's becoming firmer. The swelling is much more difficult to get rid of. And then by stage 4 is when we're seeing significant changes. I mean, it's pretty much completely fibrotic. We see all sorts of changes that can happen to the surface of the skin, like thickness, and sometimes we see some growths that happen on the skin, that staining that is a little bit irreversible at that point as well. And so that's stage 4. And we can help anybody along the way. It's just how much can we help, and how small can we get the limb, and how can we keep that skin health as good as we possibly can. So it's always easier, and we have better results the earlier the stage. The later the stage, sometimes we're dealing with some irreversible changes that have happened, but we're still always looking to make progress and have some better long-term health of the skin, okay? Because that long-term health of the skin is what keeps the risk of infection down, which is what keeps you out of the hospital, okay? So that's what we want. Now let's ask, how can therapy help? So what do we do with this? We're going to decrease the strain on the lymphatic system. We're going to reduce the risk of progressive and irreversible lymphedema. We're going to reduce the risk of cellulitis, reduce hospitalizations. And the biggest thing is reduce the economical burden of this diagnosis, okay? So the estimated cost of a single episode of cellulitis, if you get to the point of hospitalization, is $16,000. Could be even more than that, okay? So that's big. Let's not get there. Let's not do that. All right. Now, in therapy, we have what's called complete decongestive therapy. So this is when we're going to be really trying to work on the edema and skin management and everything else. So phase 1 is when we're doing the decongestive phase. So we're trying to get those legs smaller, okay? Once we get those legs smaller, then we work into the phase 2, which is our maintenance phase. So in stage 1, we're going to be doing typically manual lymphatic drainage if it's safe. Skin care, so really making sure that we're educating you on the skin, what to do to take care of maybe some areas that look of concern, how to long-term take care of your skin as well. Sometimes we're using the wrong types of soap or the wrong type of lotion or not using lotion, things like that. We'll be doing some form of compression, might be compression bandaging or an alternative. And then we're always going to be teaching some exercises to get that the muscles pumping against the veins as well. So to help with that fluid return. So that's phase 1. So these are all the different things that we do to help decrease the size of the limbs. Now, bandaging options. Like I said, we don't have to just wrap, okay, with bandages. We can also do some sort of a Velcro style garment. Sometimes we have difficulty with attending appointments. Sometimes there's balance related issues with doing compression bandaging. There's all sorts of issues where sometimes compression bandaging isn't tolerated, and then we would use an alternative, which is Velcro. It is a good option. It's not always quite the fastest results, but it is still good and we still do get results. So we're always going to work with what we have and make the best progress we can as safely as we can. Now, when we get to stage, or the phase 2 rather, of complete decongestive therapy, this is when we're maintaining. We've gotten the legs down, we've got the swelling down, we've got the skin health looking a lot better. So now we got to keep it there, right? We can't just say, okay, goodbye, good, best of luck with life. So with this, our options are some sort of a compression garment. So it could be a stocking, it could be Velcro style. There's different options there. We big time have you independent with skincare, have you independent with some sort of an exercise program, and independent with either self manual lymph drainage or the use of a compression pump. And these are all just how we're going to combat this long term to keep the condition under control. So it's something that has to be managed. It's not something that you can just kind of say poof and it's gone. All right, so to recap, Phlebolymphedema is a two-system failure, so early intervention is important, the two systems being the vascular system and the lymphatic system. And early intervention is important to reduce the progression of the stages of lymphedema, to decrease the risk of cellulitis, and to decrease the risk of wound development. So these are all the things that we're trying to get ahead of instead of being reactive to those things that are happening, okay? Movement and exercise are vital for flow of the lymphatic fluid and blood in your legs to get that blood and fluid back to the heart. So we need to get moving as well. All right, so now what can I do about my swelling? So I'm sitting here watching this video and I'm like, uh-oh, this sounds like me. Like I'm looking at my legs right now. So what do I do? Well, you have options. We all have free will. So you can ignore it. Let's say you do that. Well, maybe it'll just go away. No, it doesn't work like that. So this is a progressive condition. So it doesn't just go away. It actually only continues to get worse over time. So I would advise to not ignore it. That would be my advice. Now, I could alter it. I could do that, right? So I'm going to sit here and continue to take these diuretics and try and get rid of my fluid that way instead of just addressing it right at the source of the problem. Okay, well, there's that. So diuretics are not good for long-term use. They're difficult on kidney function, and they're not actually recommended for the lymphatic component of swelling. So you're not going to see the results you want, and it is not going to be that long-term answer, okay? Now, what else can I do? I could change it. I could change my swelling. So this is always what we're trying to get with our patients, whether it's pain or swelling or whatever else it might be. We're trying to get them to change the current state of whatever's going on to get into a good management place. So if you want to address your swelling with complete decongestive therapy, what would you expect? You would expect to see a decrease in the size of your legs. You'd expect to see improved skin health. You'd expect to see a decreased risk of the progression of the disorder. Okay, so not stopping at a stage 1 or 2, so it doesn't go into a 3 or 4. You could decrease your risk of wounds and infection, and just overall improve your health and mobility. These are all what you would expect as a very real goals to shoot for. All right, so currently the good news is that you can have great options to change your swelling. So you can come into the clinic for an evaluation, whether you're here in Jacksonville or if you're somewhere else, find somebody that's certified in the treatment of lymphedema and make sure you get those, your legs or somebody in your family or friend, make sure you're educating them about what can be done about this. We don't just have to sit back and hope it doesn't get worse, because it will. All right. If you have questions, concerns, okay, you can check out our website, premierptjax.com. We have some Q&A on there, a couple questions that are like commonly asked questions, so that you might find those to be helpful. You can shoot us an email to info@pptjax.com or give us a call. Oh, sorry, I have a typo in there. Not a typo, but I missed a little dash, but it's 904-996-6922. So I hope you found this helpful, and please feel free to like pass it on to anybody that you might think it might be helpful for. So arm yourself with knowledge. All right, everybody, it was great to talk with you.